will be Kiran Turaga, who's going to tell you a little bit about how surgeons can use Facebook.
Good morning. Hopefully in the next 10 to 15 minutes, I'll outline some of the unique characteristics of Facebook and how it affects us as surgeons, especially in our busy lives, and maybe outline some steps that all of you could use towards getting a more effective online presence, especially with Facebook. So I don't have any financial disclosures, and some of the data that I have in my slides today are from our Facebook page that we run at the Medical College of Wisconsin, which has been active for about a year. And so that's my only disclosure. What you see here is not a world map. This is a human map. And this is a map of the network that Facebook has. This is actually data points of millions of pairs of friends across the world who've been mapped out based on their Euclidean strength, the distance that they have, and the strength of the association between those pairs of friends. And you can see that China and Russia are conspicuously absent from this map. But nevertheless, this demonstrates the power of the Facebook network in reaching beyond a region, a nation, but actually to the world. And so you heard this just a little bit ago, but Facebook has more internet traffic than Google does, and it has a lower bounce rate, which means people actually come to Facebook and stay on Facebook longer than when they come to Google and move on to the next site. There's millions and millions of users, but the cool concept is that over 90% of physicians have actually used social media, not necessarily Facebook, but some social media. And surgeons are ahead of the curve, like we always are, right? We're ahead of the curve of the US population. As opposed to 42% of the US population that uses Facebook, almost 64% of surgeons have used Facebook. And so you just saw this comment, and I think this is very important to reiterate, that it's not about whether you do it or not, it's just about how well you do it. In our lives as surgeons, we have multiple dimensions. We interact with patients, with trainees, with our peers, and then we have our personal lives. And I think Facebook has unique characteristics that can affect every single dimension of our lives. When you talk about trainees, it can affect medical student and resident education, and I'll show you how, and certainly can affect recruitment, both in publicizing your program, as well as screening applicants. For patients, you can use this for fundraising, for marketing, so essentially building up your clinical volumes, getting support groups, increasing awareness, recruiting for trials, and then also monitoring for diseases. And amongst your peers, certainly for professional development, training simulations, global health, and healthcare reform. So let's look at the trainees and the effect of Facebook on trainees. Over 95% of US medical schools have a Facebook presence. And 70% of these have student groups which are active on Facebook. And 70% of students have active Facebook accounts, which means they actually post to it regularly. In fact, a group of Canadian researchers took some medical students and gave them tasks using Facebook as a media for interacting amongst themselves. And uniformly, they found that they had better interactions, better rapport building, and they actually found that they were able to perform these tasks more efficiently. And it's no surprise then that surgeons who are already ahead of the curve have several web pages. There are pages for current fellows, pages for people seeking out fellowship programs, pages for residents. And so it's very important for us as surgeons, or if you're a trainee, as a trainee, to watch out for these social media sites and make sure that the information posted is accurate and what you want for it to represent for you. And Facebook is used by potential employers and some program directors of general surgery programs for recruitment. And a JAMA article just found that almost 60% of medical schools reported students having unprofessional content online. Most often it was profanity, about 52% of the times, but 40% of the times medical students were posted with pictures of intoxication. No surprise. But if you look at our interactions with patients, Facebook can actually be a remarkable tool for fundraising, and through the sister organization called Causes, Facebook has 170 million users, and they've generated over $40 million for research projects, different kinds of research projects. And this could be something as simple as raising $1,000 for a new East Wing in your hospital. This is our insight page. So this just looks out to reaching out to people through our Facebook page. And you can see that just in the last week, for every post that we post on our Facebook page, we have 105,000 impressions. This is for a small regional area. So we're in Milwaukee, Wisconsin, which is a city of 600,000 people. But we're able to reach out to over 105,000 people with every post that we make. And the predominant demographic is that of 25 to 35-year-old male and females, with spanning the United States, South Asian countries. We can go to different cities in the world just with these posts sitting in my office without paying $1. You heard this already, that the internet takes 4 years for you to reach 50 million users. But if you create an ad on Facebook with the keyword cancer, you can reach 19 million people with that ad with an interest in cancer, 600,000 people with an interest in surgery, and 5,000 people just with an interest in laparoscopy. So if you do laparoscopy and surgery, you get a larger number of people that you can reach out to. So certainly the power of Facebook is inherent just in the number of people you can reach out to and the marketing you can do towards your patients. Now, just like Gretchen mentioned earlier, there's always concerns about social interactions from patients, and so it's not a surprise that almost 1/3 of physicians have actually received friend requests from patients. And what do you do in those circumstances? There's no guideline per se, but 85% of our peers automatically decline those. And in fact, the British Medical Association recommends that if you get a friend request with someone you're actively treating, that you should politely refuse. And I've done that, and it seems to work okay without interfering with your relationship. Now, what about interacting with your peers? I think social media is a remarkable tool for interacting with your peers. If you haven't already seen these pages, I would strongly recommend that you go see them and like them, because the American College of Surgeons, the Society of Gastrointestinal and Endoscopic Surgeons, our SAGES Society, the RAS, the Resident Associate Society, and several of our professional societies have Facebook pages, and their content is constantly being updated. We're all on this revolution together, and so therefore it's important to stay abreast of what the professional societies are doing for you. In addition, and this is just so logical, that it offers a platform for all of us to interact with each other. I mean, how often is it that you would find Dr. Soper and say, hey, Dr. Soper, I have this question. And how often do you have access to someone like that to ask him a question about your patient? And so it's very important that these sort of social medias often can offer access to these online consultations, to virtual tumor boards. I'm a surgical oncologist, and we've used social media to interact with folks from Pittsburgh and Maryland to actually perform online tumor boards. We have, you can make personal connections, you can network for jobs, and certainly having job postings on social media is acceptable. And just like you heard earlier, the news comes to you through these pages, so you don't really have to go look at the New England Journal of Medicine or Annals of Surgery all the time. You can like their pages, and all their posts will come to you on your phone or on your computer, whatever you like. As far as increasing awareness and legislation, Facebook, there's over 700 members with 700 groups of just physicians with 300,000 members. In fact, just similar to the political uprising in the Middle East, there was a Taiwanese physician who wanted to pass some legislation, and he couldn't, so he actually ended up recruiting 1,500 of his peers in 1 week with Facebook, and they were able to pass this legislation. So therefore, it has a lot of power in doing that as well. And in low-resource settings, it may provide for specialist consultation. The personal aspect of this, you heard this already, but I'm just going to reiterate it, and I thought the last line is pretty cool, so I'm re-emphasizing that. But 1 in 5 couples meet online, but 1 in 5 divorces are blamed on Facebook. So be careful of what you post there. And you can see the SAGES sing-off, the picture is small, but you can see, our physician group has been posted on Facebook as well. And so if you were doing something funny in that picture, it's there for eternity. The important concepts, we worry a lot about all of these things, about posting patient information online, and certainly you must be. because, you know, there's the HIPAA laws, but in addition to HIPAA, if the HIPAA doesn't get you, the state criminal laws can get you, the state licensure laws can get you, the state professional misconduct laws can get you, Joint Commission standards can get you, but worst of all, you can affect your interaction with your patients. So I think the key concept is if you are ever considering posting any information which is patient-specific, just make sure you have explicit consent of the patient himself. Now, also the other thing to worry about is unnecessary patient-provider interaction, which would mean that you start engaging in a relationship with the patient, not you know, a professional relationship, but you start giving advice, in which case then you become liable. So there's medical legal consequences as well. So be a little cautious when you look at these things. So what should you do now? First and foremost, think about who you are, where you are, and who do you want to target with your social media? Why do you want to target them? How are you going to target them? And then the technologies are available. Facebook, Twitter, and all the other social media you'll hear are incredibly easy to use. And measuring these tools are just phenomenally easy. You can just go to the Facebook Insights page, and you'll see who's following you, how old they are, where they're from, how many likes you have, etc. So step one is you open an account. The account should be separate from your personal page, and you can actually link both of them, so you don't have two passwords, you don't have two accounts in that sense, but they're both linked. But it's a professional page, only your patients can see that, you can like whoever, but that doesn't affect your personal page. Invite your contacts, invite your friends, have them come follow you. Make sure that your main website has a like icon, and that's very easy HTML feed that your web administrator can easily put on your main web page for you. Download the app on your phone, be active, watch what's happening on your Facebook page. Make sure you establish policies. What are you going to do with patient interactions? What kind of posts? Who can post? Who has the administrative privileges? Who can delete these posts? Make sure you work within your hospital or university policy. Most hospitals and universities now have policies on this. And then make sure you include disclaimers saying that, you know, we're not responsible for, you know, information and stuff like that. And then make sure your content is interesting. You know, that's what we all want to see, is interesting content. And make sure you encourage participation polls, ask patients or friends to post pictures. You know, you go to a symposium, someone gives a talk, you post pictures from the talk, and make sure it's updated and maintained all the time. You know, and I'll tell you, it's very easy to do it. You know, we're all busy and we all operate, and you know, the last thing you want to do in the end of the day is to sit and post on your Facebook account. But I think certainly even once a week posting, you did something interesting, you came to SAGES, you gave a talk, you heard a talk. You know, these are all things you can just post and say, hey, I heard this fantastic talk from Kiran Turaga, you know, I like it, right? And the other thing is you can link your Facebook page to Twitter. So you can get the power of two with one. So you just go to the Facebook page and you link it, so every post you put on Facebook goes on Twitter, so you automatically have double, or maybe not double, but you know, you have a lot of more people. And so I think, you know, just with some simple rules, common sense, I think you'll be all set to start on the social media bandwagon, and I thank you for your attention.